Ladies and gentlemen, my name's Francesca. I am a mother of two very, very busy children who are 8 and 7. And I'm very fortunate to be in the first aid business because I can tell you I have used it on a number of occasions at home with my family. So what I want to start with is by asking, do you have the knowledge or the equipment to be able to help you in a first aid situation? St John is South Australia's leading first aid provider. We've been educating and equipping the community for more than 130 years. Most of you in the room today are about to embark on an exciting new journey. You're either having your first baby or you're adding to your existing family. Now, St John are here to help you gain important knowledge and equipment to put you in the best position should something happen to your precious bundle or anybody in your family. Now, the ways that we do this is by offering our short Caring for Kids course, our 3-hour non-accredited course. This particular course covers asthma, anaphylaxis, choking and CPR. The other ways we can help you is by providing invaluable resources to use post-course, or if you've done a first aid course, this will help you out in terms of giving you vital information for children. And we're also here to help you with having the right equipment. So this is our Tiny Tots kit, in which I'll talk about a little bit more later. So we do have a whole range of kits at St John's, and just to give you an idea, there's some of them up there, and it can get quite confusing. So today I am just going to focus on our Tiny Tot kit. As you can see, it's the one I'm holding here. Now, this is designed by a group of parents at St John for parents. So totally portable. It's got a little hook here, which is designed to clip onto your nappy bag or onto your pram. Neutral in colour, so it's great if you've got a bestie who's pregnant and you're not quite sure what they're having yet. But in here, it's got all of the things that you're going to need to get you out of trouble when you're out and about on the go. So let's just say you've got sand in your eye, your little one's fallen over, you've got a bump and you need to get an ice pack on it. It's all in here, so it's going to get you out of trouble. Now, I've shown you our first aid kit, and I'm sure that some of you, we've sold a heap of them today, so you may even have them in the bottom of your prams already. But what we're frightened of is that you guys are going to get it home tonight, you're going to bust open the packaging, look inside and go, what do I do with all these things? So that's where I'm going to spend the rest of my presentation here, helping you understand, once you open your kit, how do you use each of those items? The first one we're going to have a look at, and I have experienced this quite a bit in my family, is the graze. Now, sure as eggs, you guys have probably all had one in your life. You've fallen over on gravel or cement and you've grazed your hands or grazed your knee. Yeah, you know what I'm talking about? Now, whilst we might think these are minor, little children can get quite distressed at the sight of a graze or blood. So one of the first things I really need you to do is to reassure them and calm them down. Now, I have a little model here at the front of the room by the name of Jake, and Jake's going to come up and let me use his arm today, and I'm going to show you how to dress or how to deal with a graze with the items in your first aid kit. Do you want to come up? Excellent. So you turn around for me, Jake. Show them all your strong arm. Don't steal my show, okay? All right. So the first thing you want to do is open up your first aid kit and grab your saline. Okay, it's a little tube. The other thing you'll find in your first aid kit is a set of gauze swabs. You'll find that if you rip just the top off, it creates a packet for you. So once you've opened your saline, you can tip some into your gauze swabs, and the water is totally contained and it will absorb into them for you. Okay, now if you've got any saline left, the first thing I'd be doing, let's just say that Jake's got his graze here, I'd be squirting the remainder of the saline over the graze to wash off any dirt. Then you want to be grabbing one of your gauze swabs. Now they're going to be moist, and then we're just wiping. Guys, please be mindful of infection. You just want one wipe, one swipe, then get rid of that gauze swab. You've got more in there to use, okay? So keep going through until that's fairly clean. The next thing you want to be grabbing is a non-adherent dressing. Okay, a non-adherent, if you feel it both sides, it's quite slippery. Okay, you need a non-adherent because this is not going to stick to that graze. You don't want to be putting fluffy cotton wool or tissues on there because it's going to stick and become painful for you. So we're popping that on the graze, and then I've just got myself out the little bandage. Okay. Now I'm not going to use the whole bandage because I'm mindful of time. There we go. Now I'm just going to tuck that in there, Jake, just to show them. There you go. Would you like to model that? There you go, guys. So if you're out and about at the park, your little one's fallen over and had a graze, grab your first aid kit and that's how you treat it. He'll be as happy now to go off and play on the equipment. Don't try and make him leave the park because he won't want to go. Good work. I'll sit down. I'll take that off for you later. Okay. So the next one we're going to have a quick look at is splinters. Inside of our Tiny Tots first aid kit, we've actually got some splinter probes. Okay, so no more do you need to worry about getting out the needle, putting it under some hot water and sterilising it. You would reach straight for the splinter probes, bust open the splinter packet. Now the instructions are there behind me. Ideally what you want to do is grab the tweezers out of here as well and try and remove the splinter from the same direction that it entered the body. Okay, so that's the way you want to take it out. If it's not removing, you may need to just open the skin a little bit more, and that's where you would use your splinter probe. But the tweezers and your splinter probes are there in there. Okay, I can tell you that my little boy, who's 7 years old, is a tree climber. We often get splinters when we're out and about. So it's great to just grab it, deal with it, and we're done. We keep playing. Okay, the last one is sand, dirt, grit in the eye. Those of you who have got children, say Jake's age, would know that as your children start to go down to the beach or into the sand pit, they love the feel of sand, okay? They love to pick it up and let it drop. My little boy used to pick it up and put it on his head, and it used to fall all the way down. So of course, what do you end up with? You generally end up with sand in the eye, okay? It's going to happen. What you want to avoid doing in this situation is rubbing, because that sand, if you're going to rub it, will actually damage the front of your eye. It can scratch, okay? Grab your first aid kit, look for your saline tubes again, and then what you can do is just irrigate that eye. So you're gently squeezing it and washing so that if there's any sand or dirt particle in there, it's escaping the eye with the help of your saline. Okay? So I think I've covered 3 of the most common injuries that we get when we're out and about. What I do want to do now is just to introduce you to our first aid resource. I call this our first aid Bible. I'm not quite sure how good your eyes are, but if I just show you, it's very well illustrated, very well written. What I love about this book is that it's going to take you from infant right through to teenage years. It covers heat stroke, it covers broken bones, it covers belly aches, toothaches, earaches, CPR. You'll find that when you open it up, it's got some very quick steps, generally no more than 3. 1, 2, 3, you look at the pictures, you know exactly what you've got to do to deal with the situation in front of you. Okay. Now, if you do our Caring for Kids course, this resource comes free as a part of doing the course. However, if you don't do the course and you feel like that's something that you want to have as part of your children's resource library at home, come and see us. We are over that side of the room. We've got this reduced for the Expo. It's down to $20, so it's a great little buy. It's also a great gift for grandparents and grandparents, because I know I was not quite sure what my parents, and thankfully my mother's not here, but what her capability was like in terms of first aid. So this was one that I gave to her. Okay, so before I finish, are there any questions? Is there something that anybody would like to ask in terms of how to treat an injury? Perfect. Okay, so just in closing, we do like to just mention that St John is a non-for-profit charity organisation. So any money that you do spend with us does go back into our volunteer arm. We do programs like cadets, so educating the youth. We also do first aid in schools, which is a totally free program where we go in and teach school children how to do first aid. And we also have our community care volunteer program. So our community care is designed to go in and stay with the elderly, keep the elderly company if they are unable to go into a nursing home. Okay, so on that note, Nicole, I'll finish up.
Thanks so much, Francesca.